So now it is my honor to introduce Dr. Gail Christopher, Vice President of Program Strategy for the W.K. Kellogg Foundation. And I didn't even get to tell you the wonderful things about her yet. Wait till you hear. So the Kellogg Foundation is committed to improving the health and well-being of all children and sees schools as an important context for promoting student wellness and addressing racial equity. I should mention that the Kellogg Foundation has been very generous to supporting work here in Chicago and has been a strong supporter of the Healthy Schools campaign. In all of her roles, Dr. Christopher has addressed health disparities and public policy. Prior to coming to the Kellogg Foundation, Dr. Christopher was with the Joint Center for Political and Economic Studies, Office of Health, Women, and Families. She was a guest scholar at the Governance Studies at the Brookings Institute and executive director of the Institute for Government Innovation at Harvard's John F. Kennedy School of Government. We are so honored to have Dr. Christopher with us today.
Good morning. Thank you. I must say that coming to Chicago is coming home for me. I lived here for more than 25 years. I raised my children here. And so I am so excited that Chicago is a place that the nation is looking to for innovation and inspiration and guidance around the issue that is absolutely the most important issue for the future of this country. The children are the future of this country, and we must do better. Now, I don't have a long time. Most of you who know me, I can talk all day, so I'll have to condense what I'm feeling and what I want to share with you. But the fact is, most of the children in this nation will soon be children of color. So when we talk about issues of health equity, we are talking about the issues that our entire nation must face. It is not a we-they conversation. It is an us conversation. And so please take that message back to your institutions and your organizations. This is not about those students. This is not about those families. This is about our nation and our children. I'm going to share some slides with you. So if, do I do that or do you do that? Okay. Just press the green button. Okay. At the Kellogg Foundation, and the foundation is separate from the company, I must make that clear, our vision that guides our work is that we envision a nation that marshals its resources to assure that all children have an equitable and promising future, a nation in which all children thrive. And we know in order to do that, we have to address the inequities and the disparities. Our mission is really focused on communities, creating conditions that propel vulnerable children to achieve success. One of the things that's unique about the Kellogg Foundation, Mr. Kellogg said, do what you will with the money so long as it helps children. But he also believed in helping people to help themselves. So one of the sort of signatures of Kellogg is that we've always worked very closely with communities. We've been a foundation that wanted to connect to people on the ground in communities who are doing innovative, creative things. And so this statement from the Ottawa Charter, the role of communities, to reach a state of complete physical, mental, and social well-being, an individual or a group must be able to identify and realize aspirations, to satisfy needs, and to change or cope with the environment. And these words are very important when it comes to dealing with health disparities. It's about perceptions of power and control. People cannot achieve their fullest health potential unless they're able to take control of those things that determine their health. Those things that determine their health. Health determinants. And access to medical care is one of those things, but it affects health. Some estimates are as low as 10%, some say 15%, some say 20%, but the broader world of health is shaped by community conditions. The moving upstream, the predictor of life expectancy in this country is education. So when we talk about making a school system work, we're talking about health. When we talk about environments, I was reading a statistic the other day that just kind of, I knew it, but seeing it in black and white really shocked me. If a community has a population that is 25% people of color, its exposure to toxic waste, its cumulative exposure to hazardous waste is 9 times that of a community that is only 5% people of color. Now think about that. The air that's being taken in on a daily basis, 9 times the level of exposure to hazardous waste, which are located near those communities. Now, we at the Kellogg Foundation have made a bold statement. We feel that one of the social determinants of health is racism. Now, many people say, let's call it social, let's call it environmental, let's call it many things, but let's not call out the word racism, because I'm not a racist, and I don't know any racists. So if you bring up the term racism, that's a slap in the face to good Americans. But when you hear data like the data I just gave you, 9 times, why is that? Why are those communities, why are those waste dumps being located in those communities? Some would say it's expedient for those companies. I would say it's because there is a collective devaluation of those communities that has something to do with their pigmentation or the lack thereof. And so at Kellogg, we're really trying to say to this country, it is time to find creative and effective ways to deal with our legacy of a belief system. And that's what it is. It's a belief system that values people based on physical characteristics and devalues others based on physical characteristics. And it's a value system upon which this country was built. And it's been less than a century when that was even acknowledged, and we put laws into place to do something about it. So you compare less than a century, something like a half a century, to 4 centuries of an embedded belief system, and how can you expect us to have overcome that legacy that quickly? Dolores Acevedo Garcia is one of the researchers that we support, and she has coined the term double jeopardy and reminds us of the stark contrast in opportunity for children of color. 20% or more of Hispanic children live not only in poor families entrapped in poor communities. 16% of black children face that same dilemma, compared to 1.4% of white children. If we had an equitable situation in our schools, this is how it would look in terms of those children that are receiving free and reduced price lunches. But this is how it looks. We are almost as segregated residentially in this country today as South Africa was at the peak of apartheid. So what we're suggesting, and my time is just about up, is that part of the toolkit, part of what we have to do as we work on disparities, is equip our educators, our health practitioners, our political leaders, our civic leaders, to recognize the power of racism on a conscious and unconscious level, and we have to mobilize as a nation to do away with it. One speaker said we have to put race in front of us so that we can put it behind us. and we agree with that. I could talk about the physiological and biochemical impacts of discrimination. I would say to you that the focus on health and well-being helps to mitigate the effects of those exposures. So keep doing what you're doing, but add to it some very specific tools to help address the bombardment that these children receive of messages that devalues them as human beings. My time is up. We'll have more time during question and answer. But at the Kellogg Foundation, we have supported communities around this country who are willing to roll up their sleeves and do the hard work of tackling the legacy of the racial divide that is part of their history. And so we invite you to become part of that effort so that, perhaps not in my lifetime, but in your lifetimes and in the lifetime of my children, we will no longer need to have the discussion about the role of racism in America. But at this point, we still do. Thank you.